Hi everyone, my name is Michael Ramada, and today I'll be talking a little bit about some of the long-term complications you can see with fatty liver disease. First and foremost, with fatty liver disease, it's important to know that there are some long-term chronic health issues that are deeply associated with the disease. These are things that can have an overall negative effect on your overall health. Things like high blood pressure, high cholesterol, and even obesity. There's known to be significant linkages between any of those three conditions along with fatty liver disease. So it's important to keep a lookout and be aware that this is a potential that fatty liver disease does have some kind of a complication associated with these conditions. In terms of the actual complications of the fatty liver disease itself, one of the most important things I want to discuss is the basically overall damage that occurs when these specific fat cells in the liver um, build up, and they essentially cause changes on a molecular and cellular level for the liver cells, such that they end up getting hardening of these liver cells. We call that fibrosis or scarring of the liver. Eventually, if enough of these cells are fibrosed and become more stiff, they're not working properly, and eventually you can end up getting more long-term damage to your liver, known as cirrhosis. You could probably have heard about this in the context of a lot of alcohol use, but it is a complication that you can see with fatty liver disease as well. Now, when these liver cells are cirrhosed, they aren't working properly. What does that mean long term? That essentially means a bunch of different complications can stem from that, including easier bleeding. Your liver makes some of the basically chemicals in your body that help clot blood. So if your liver cells aren't working properly, that leads to easier bleeding overall, and that can lead to a lot of complications as well. Things also another thing that can also affect you is you had a fluid buildup in the body. We call this ascites, but essentially you have a lot of basically backing up of fluid in the vessels in the vasculature in your liver, in your blood vessels there, meaning that if a lot of stuff stays put, it'll eventually leak out into the rest of the body, leading to a lot of fluid buildup there. That fluid can also lead to infection as well, by bacteria in your gut, and that can also be a very serious complication of fatty liver disease too. In addition, some other things to know about are that you can also get kidney problems as a result of your liver dysfunction. You can also have confusion as a result of the basically lack of removal of these toxins and buildup of ammonia and other things in your system that can cause you to become confused. Lastly, we are also looking at yellowing of the skin, known as jaundice, that can be a result as these liver cells have a hard time of getting rid of your blood products, essentially, that are circulating through your blood. Old blood cells are converted into waste products that you eventually excrete through stool and urine. However, the liver is the main organ in charge of doing that, and therefore if they're not functioning correctly, they're going to be building up in your body and eventually leaking into your bloodstream. The last thing I do want to mention as well is that fatty liver, if left untreated, can lead to this fibrosis, and scarring of your liver can lead to cirrhosis, as we discussed. And basically, due to the changes that have been going on with the cells, there's also a risk of having hepatocellular carcinoma. It's a type of liver cancer that can occur. So as you can see, fatty liver disease is something to take very seriously. And as a result, it's important to, be aware of these complications, and see what you can do about speaking with your hepatologist, or, talking with them about what you can do to kind of mitigate these complications and, hopefully live a longer and happy life. All right. Thanks, guys.